I decided to cover today was the effect of a very low calorie diet versus a moderate energy deficit diet in obese women with polycystic ovarian syndrome. And it was a randomized control trial presented by myself, Brianna Reed. And so the overall idea of this article is that they're discussing polycystic ovarian syndrome, PCOS, as the most common endocrine disorder in women. It's about 5 to 21%. It affects about 5 to 21% of women of reproductive age. A main part of PCOS is typically having insulin resistance, and that causes hyperandrogenism, which then leads to clinical symptoms such as hirsutism, acne, and polycystic ovaries. And it is one of the leading causes of anovulatory infertility. And people with PCOS do have an increased risk of type 2 diabetes, metabolic syndrome, cardiovascular disease, and mental disorders such as anxiety, depression, and then also body dissatisfaction. And people who do become pregnant with this condition, it does increase the risk of complications during pregnancy. Individuals with PCOS also often have difficulties in maintaining their weight. About 75% of women with PCOS are overweight and or obese. And with that, weight loss has, beneficial effects on PCOS outcomes. And it's typically one of the first things that they recommend with individuals with PCOS is to lose weight through lifestyle modification, like diet and exercise, and stress management techniques. And so the purpose of the study was because most of the past studies in this population are focusing on calorie deficits for weight loss, and they've just been moderate, so anywhere from 500 to 1,000 calories a day, and with or without anti-obesity medications or medications that kind of reduce androgens like spironolactone or metformin. And so the very low calorie deficit or very low calorie diets in this population still remain understudied. And so for them, the very low calorie diet is defined of calories less than 800 calories a day. And so main focus, they want to compare the effects of a very low calorie diet versus a conventional energy deficit on outcomes of body weight, body composition, androgen levels, hormones, and other metabolic parameters in people who have PCOS that are overweight and or obese. And so they did an open label randomized comparative study, so the people who got the interventions knew what they were going to get. This study was conducted through the Academic Diabetes Endocrinology and Metabolism Research Center. And so on the first visit, each group was randomly assigned the intervention, either a very low calorie diet or a conventional approach to calorie deficit, and the study did last for 16 weeks. The first 8 weeks of intervention, they did the intervention, and then the other 8 weeks, they reintroduced more calories to the diet, and then they did the follow-up. Baseline measurements were done at 4 weeks. That was a visit 1, but prior to conducting the study. So they looked at weight, BMI, waist circumference, hip circumference, body composition, fasting glucose, fasting insulin, HOMA-IR, total cholesterol, LDL cholesterol, HDL cholesterol, triglycerides, HSCRP, and blood pressure. And measurements were taken at 8 weeks and then at 16 weeks. And so what they found was that both diets, the very low calorie, the interventions here were the very low calorie diet and then the conventional energy deficit. First 8 weeks, the very low calorie diet group, they followed 800 calories a day through soups and drinks, basically meal replacements that also had vitamins and minerals to make up for that lack of energy. The meal replacements each had 200 calories, 21 grams of carbs, 15 grams of protein, 3 to 4 grams of fat, and then again all of your micronutrients. The 8 week following the intervention, they reintroduced 200 calories each week until 1,600 calories were reached. And then the control group, they calculated the calories based off of gender, age, weight, and then their resting metabolic rate. Once that was calculated, they gave them a 600 calorie deficit each day. And then each group did receive nutrition education using the Eat Well guidelines. And so what they found in the participants, so they were women aged 18 to 45 with a BMI between 30 and 45, and they had to be diagnosed with PCOS. And that criteria for PCOS to be diagnosed, they used the Rotterdam criteria. And then the free androgen index had to be greater than 4, and then their self-reporting cycles greater than 35 days, and or an absence of your menstrual or your period greater than 3 months. And then they did have to use an effective non-hormonal birth control during the trial. Who was excluded? People who were going through menopause, perimenopause, pregnant, or the intention to become pregnant. They couldn't have been losing weight more than 5 pounds during the last 6 months before the trial, no diagnosis of type 2 diabetes, and then also no uncontrolled thyroid disorders or eating disorders. And they weren't allowed to be on any meds 4 to 8 weeks before the trial, so meds like spironolactone, metformin, and things like that, or like any weight loss drugs. And so at the end of this, 21 people were in the very low calorie diet group, and then 19 in the conventional energy deficit diet. And then at the very end, only 11 were really measured for the very low calorie diet, and 11 in the conventional diet group in the 8-week follow-up. And what they did find was that both diets did induce short-term weight loss and favorable body composition. However, the very low-calorie diet resulted in greater weight loss and improvements in body composition, hyperandrogenemia, and other metabolic parameters. The very low-calorie diet, they did lose 11% of initial body weight after 8 weeks, and then after 16 weeks, they lost 16%, and then there was a 32% reduction in the free androgen index. Versus the conventional energy deficit diet resulted in only about 3.9% loss after 8 weeks, and then 8% reduction in the free androgen index. And so the strengths of the study was that there were very clear intervention guidelines, and it is the first study that they're comparing a very low calorie diet and a conventional energy deficit in this specific population. The weaknesses was that it was a small design. I mean, at the end of it, there was only 11 people in each group. Half of the participants obviously didn't complete the trial in both groups. And then because the groups knew what intervention that they were given, they were a little bit disappointed because obviously the very low-calorie diet had a bigger increase in weight loss versus the conventional. So there was a little disappointment there. And then at the 8 weeks during the food reintroduction phase, there was limited engagement because one of the dietitians in the study moved away late stage, and so there wasn't a whole lot of follow-up, so that kind of tapered off. The author's conclusion is that both diets can be used for weight loss. Obviously, the very low-calorie diet does show greater results in all measurements that they were assessing, and then more studies do need to be conducted on very low-calorie diets in the PCOS population. And overall conclusion is that obviously the study had some limitations, but good improvements in weight loss, that's what we're looking for in this population to better hopefully improve their symptoms. And then the very low calorie diet does seem to be better for rapid weight loss in such a short amount of time. And then overall improvements in the outcomes that were being measured were better in the very low calorie diet. More studies do need to be completed, and I definitely would be interested in seeing if they can do maybe a 6 to 12 month follow-up just to see if any of that weight is being regained. But that concludes the presentation for today, and thank you for listening.